Okay.
What we're doing today is we're going to demonstrate the proper procedures of how to do a PFT or a spirometer test. Keep in mind that anytime a PFT comes into your office, that the machine has to be calibrated on the same date of the test. The first thing we're going to do is we're going to demonstrate the proper procedures of how to calibrate the machine. The first thing we want to go over is the product itself. What we have here is the calibration syringe or the calibration chamber. This on the end here is the mouthpiece, which detaches, and there is the line that goes into the actual machine itself. The base unit can be removed, so if you have to go into an exam room to do a PFT, this can be done very easily. But keep in mind, doing the calibration and doing the printout on the paper, the base has to be locked into the home base. There are little receptacles here that have to line up with the home base for it to work. Make sure that it's in properly, and at this point the calibration can begin. The first thing that we're going to do, of course, is we're going to flip the switch on. We're going to turn on the calibration, the base unit. The first thing you're going to notice is the last time the calibration check was done on this machine was on 10/7, which tells me the last spirometer test must have been done on 10/7. The first thing you do is when you see the ID flashing, you want to hit the 4, the CAL for calibration, and you want to hit.
Yeah.
We're going to push the test, which is on the button says test, and the calibration, which is 4, and it's automatically going to bring up CAL type. It's going to be a 1, so you push the 1 and you hit the enter. This is very important, the next step, the room temperature, because this is going to it's going to make the adjustments according to the room temperature. We keep our rooms around 75 degrees, but make sure you always check the temperature on a thermostat to make sure that you have the proper setting in here. If it was 77, simply just push in 77 and enter. So once that's done and you feel good about the temperature, push enter. The pneumotac will always be 1. You push that.
What was the question there? Okay, it says which pneumotac, basically, which model, and ours is model 1.
Right, model 1. And then that would be enter. Now at this point what it's going to say is keep pneumotac steady. Now what that means is the syringe has to be sitting on a flat surface, and it just told us to withdraw the syringe. This is the syringe.
So when we're testing, you do not withdraw it until the machine tells you withdraw syringe.
Exactly. Now the machine is going to say press any key to start calibration check. Of course you can push anything. You can push enter.
Okay.
Do XL calibration. You want to do it fast and steady. And you're going to hear a funny noise, and then it's going to bring you to this right here. As long as you're in 1%.
You see it says it's giving you expiratory volume. The cylinder is known to be 3 liters, and this gives you its percent. It gives you what it measured, here in this case 3.03, and percent error, which here is 1%.
That is correct.
And the total, the maximum allowable is 5%? Is that correct?
At this point your calibration is completed, and you want to go ahead and start the testing of the patient. Keep in mind, patients, it's very important to get accurate information on them, and the information should be in the chart, but a lot of times people are very leery about giving out a lot of information. At this point what you want to do is you want to push the new patient button.
Which
just like that.
Okay.
That's on the right hand side, the second button down.
Okay.
ID is going to be the chart number. At this point we're just going to make up a chart number 1, 2, 3, 4. And at that point, once you have that in there, you would push the enter button. The age is flashing now, so what you want to do is you want to push, let's say an example of 45 years old. Every time you put something in, you always have to hit the enter button. The height, it always has to be entered in inches. So if somebody was 5'5", it would be 65 inches. 6'5", and enter. And then it's going to tell you if you're right or not. The next one is going to say sex. 1 for male, 2 for female. We will push the 1 and enter. The weight of the patient, we're going to say the patient weighs 150, and we're going to push enter.
The entry screen at this point says race adjust, and your options are 1, yes, you're going to change the race, or 2, no, you do not want to change.
Automatically default to a Caucasian. So if you have a black man to come in and if you want to do a race adjust, you would want to hit the yes button, which would be the 1, because it's going to default as a Caucasian. So what we would do is we would hit the 1 and enter, which tells me that this is a 45-year-old black man. Smoker, 1 for yes, 2 for no. We're going to just say he is a smoker. We're going to push the 1 and we're going to hit the enter. At this point, what you want to do is you want to have the patient.
Every mouthpiece is new and sealed in plastic.
Yes. Have the patient remove it themselves.
Okay, we make a practice of having the patient see that it is in the sealed package, and he removes it themselves.
Now, the hose that comes off the side of the base is what attaches to the mouthpiece. Keep in mind, you do not want to touch the end of the mouthpiece, this is where the patient's mouth will be. You attach the hose to the bottom part of the mouthpiece. Always have your patient standing as opposed to sitting, because they're going to be able to get more lung volume that way. And what you want to do is at this point,
the window, the last entry we were at on the computer was temperature, which you correct if need be to the degrees Fahrenheit, and then the next step is hitting enter.
And at this point it's going to tell you pre-med test, and you're going to, what this is, it's going to allow you to do your test. You always want to hit the number 1.
It's asking you to select type. Right. Type is always 1.
Now at this point the machine is saying keep pneumatic steady, and it's zeroing. At this point what you want to do, the machine is going to say blow. What I would recommend is at this point, before you actually initiate the test, is have the patient give you a couple of big breaths to clear out their lungs, especially if they are smokers. Of course, they are standing. Give a couple cleansing breaths and have them stand at the ready with the mouthpiece close at hand. What you're going to do is you're going to give them a countdown of 3, 2, 1, and then when this machine says blow, you want them to put their mouth firmly around the mouthpiece, big breath, and blow very hard. They have to blow for a minimum of 3 to 5 seconds, and that's going to be hard for some people to do. A lot of times people think that they're not blowing out air, but they are. You have to coach them steadily to keep blowing, blowing, blowing until the machine tells you that the machine is done.
And this is really the important part. The patient needs to exhale as quickly and as much as he can. Many patients we see purse their lips like they're going to blow a musical instrument. The lips should not be pursed at all. It should be open entirely on the mouthpiece, and they should be blowing out as rapidly as they can.
Keep in mind that whatever the patient does, the machine is going to tell you the problem. It's going to say stopped blowing. It's going to say the patient coughed. Whatever the patient did wrong, the machine will tell you. Keep in mind, you have to coach these patients through this. You have to really get after them to tell them to blow, 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 blow. The biggest mistake I probably see with this is people don't blow hard enough, fast enough. And a lot of times people will think that they've ran out of air and they will stop blowing. Tell them to give you an effort until you tell them to stop.
And you'll be coaxing them for about 10 seconds to get a good full breath. We've tried that. It is very hard, so you do need to keep encouraging them, telling them to blow, 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 and give them a little bit of countdown, 3 seconds, 2 seconds, 1 second, to encourage them to finish the full exhalation.
And another mistake I see people making is they hold the mouthpiece too far away from them. When you are ready to initiate the test, have them have the mouthpiece very close to their lips. That way, when it's time to blow, they are ready to go.